So today, I think we just want to start by, I'll give a brief overview of what the fellowship is, and then I really want to spend the most time letting you hear from students who are current or former fellows, and then just wrap up by sharing some next steps for anyone who thinks they're interested and want to move forward with applying by our February 1st deadline. So some of those questions that I think we'll hopefully answer for you today, as well as many others, are, really just sharing advice from the fellows themselves, and then helping you see how this experience could maybe help you advance your professional and personal goals. So the Albert Schweitzer Fellowship is really about equipping healthcare and human service professionals in order to identify and address health disparities. So I like to tell people that, and in its stated form, you are really the product that we're trying to invest in and equip. But I think we have an unstated mission, which is obviously to do right by the community and to try to invest our time and efforts in a way that builds the community in ways that they kind of define as needs and priorities for themselves. So our tagline there, improving health, developing leaders, and creating change, is because that is essentially what we're trying to do, both through your projects and then through the skills that you're going to learn that you'll carry on with you in your future selves. We do define health, though, really broadly. So if there's anyone joining us who might be in a field where you're like, I don't really consider myself a health professional, is this really for me? I would say yes, like any field is welcome to apply to the fellowship. We do want your project to be focused on improving either physical, social, mental well-being of individuals. But I think you can tell when we think about that, World Health definition of health, it's not just the absence of disease. So we do it through kind of a 2 or 3 prong approach. What you're most familiar with is probably the fellowship project that each student either has that they work on as an individual or with a partner. And that is kind of, I think, the main part of the fellowship. But I also want to touch on the fact that we do come together and have these educational workshops. And this is where you get to learn from leaders in not just academia, but we really try to elevate the voice of community leaders as well, to learn about things like understanding the impacts of the social determinants of health, being able to engage in communities using cultural humility, doing this work in a way that buffers you, kind of like encourages self-care and buffers against burnout, because we don't want to equip you to go into these fields and then run out of energy to do it. So, and we also, I think, in Alabama, focus on communication skills, and then recently have tried to do a little bit more to learn about rural health, because we recognize that a majority of our state is rural, and it's not necessarily where our fellowship projects are taking place. So the project itself, though, you see a few of the sort of factors there. It is 200 hours. You do collaborate with a community organization, so you're not doing it alone. And part of what you're learning then is how to plan it and implement it and evaluate it, and hopefully figure out a way to sustain it once you have finished your year. So these are some pictures of projects, and I just use it to illustrate kind of the breadth of what can be done. Can be everything from taking place in, like a K through 12 setting, focused on mentorship and education. It can be focused more on like that well-being, using something physical and active. We have projects that deal with people's mental and social well-being, which is that top right image of like a caregiver support group. And then some of the bottom images are diabetes education. So we obviously have a lot of chronic disease work to be done. There's an HIV/AIDS mobile clinic that was developed with some of our fellows, and then a social companionship program. So it spans the gamut in terms of age that you can target, everything from kids to seniors. It can be kind of health education, etc. And what I would encourage you to do if you want to read more about those projects or even others that are have been done. We have a description of all of our fellowship projects dating back from 2016 until now with our 2020 fellows on our website that you see there. So I encourage you to check those out as well. So I'm about to turn it over to our fellows so they can tell you about theirs, but I'll just touch on the fact that some of the benefits that we think students get out of this are, I think, it's obviously about the learning that takes place and what you can gain from the relationships with your site, from your mentors, from your ASF peers, and then obviously just your project participants as well. We do provide a stipend. It'll be $2,500 for those who are participating in 2021 until 2022. And I think we're, trying to really flesh out what that means to be part of this national organization. But there are a growing number of opportunities to connect with other fellows and fellows for life in the chapters around the country. So Alabama, I don't think I mentioned this, but Alabama is one of 13 sites. And we are starting to do even some of our monthly meetings with other chapters, as well as sort of we have some webinars and things that take place across the network. The pictures on the right, I'm about to turn over to Rachel, and those are some pictures from her project back in 2016. And she'll tell you more about what she did to mobilize a lot of other individuals beyond just herself. And then that picture on the left was Catherine Jones. She was a 2017 fellow. And since we're talking tonight largely about sort of impact on career and clarifying your professional goals, I think it is worth mentioning that Catherine is an example of someone whose project really informed, I think, what she ultimately decided she wanted to study, and is now in a PhD program in rehabilitation science. So with that, I'd like to introduce three fellows that we have with us tonight: Rachel Stokes, Ana Ospina, and Abigayle Kraus. I'm going to let each of them speak for a few minutes. And like I said, I'll be monitoring the chat. So if you can either unmute yourself and ask a question as we go, or add it to chat. And then we'll also have time at the end to answer all of your questions as well. So Rachel, do you want to speak first?
Sure. So yeah, my name is Rachel Stokes. I was a fellow in 2016 to 2017. I was a fellow while I was at UAB. I went to the School of Public Health and got a master's in public health and environmental health and toxicology. And I'm currently a Sanford student. I'm working on my DRPH, which is the doctorate for public health students, through the Sanford School of Public Health. So it's exciting to be able to talk to you guys. I currently work in Arizona with the Indian tribe through the Indian Health Service. So as far as applying my project, it's a little bit different. So my project worked in Birmingham. I worked with the Village Creek Society. So they kind of protect the watershed that's along Village Creek. It runs, I think, about 40 miles through North Birmingham. So if you ever drive, you probably just totally miss it. A lot of times it's really hard to see Village Creek if you don't know where it is. But if you ever see it, you'll see a lot of trash, just a really poorly upkept watershed. So we wanted to educate the community on the resource they had, like right there running through their neighborhoods, and then trying to clean out some of the trash that was in there. So you saw the picture. We cleaned out a lot of trash, and I forget the exact number, but it was a lot of trash that was in there. As far as connecting that to what I do now, I still work in environmental health. I'm an environmental health specialist. The community I work in actually has a huge solid waste problem. So there's a lot of trash like on the roadways and within the community. So just flat out applying my project, I've helped some of the community members set up trash pickups and different campaigns to help clear some of the trash out. Where I am, we see a lot of tick-borne diseases, and when we try to apply pesticide to keep the tick numbers down, it's really hard when there's a lot of trash that they can hide under. So, that's kind of straight up application of what I learned as a fellow. Beyond that, I really learned how to plan a project. When I came into the government, I came in as a pathways employee, which means that you're basically a recent grad and you're tasked with doing a project within your first 2 years. So I was like, oh my gosh, I've already done this. So I learned how to do like logic models and really set things up. So it made that whole process a lot easier for me because I'd already done it as a fellow. So even though my project was totally different on pathways, but I really was able to apply some of those items as well. Yeah, I think that's just about it. I don't know if anyone has any questions.
So, Rachel, in terms of any advice you would have for applicants or people who are thinking of applying, any general thoughts?
I think I would recommend considering what your interests are. Make sure that you're doing a project that's something that you're actually kind of passionate about, not something that you think, would look good on a resume or somewhere else. It is 200 hours. And while that seems like a lot, it did go by pretty quick for me. Again, because I really enjoyed what I was doing. I had the opportunity to meet a lot of really cool people within the city of Birmingham and the neighborhoods that we worked with. So it was just a really great experience for me to be able to work with that organization and do something that was a little bit different. Again, being environmental, sometimes people forget that there's a really, really big connection between the environment and health. So it kind of helped me pull all that together and be able to share that with other disciplines as well.
How did you get in contact with your community partner? Um, how did you like go through the steps of like researching different community partners and then like get in contact with them and like develop the project with them? Like, could you give me just a short overview of what that was like?
So I actually set up a project with another partner, and then it wasn't a good fit once I actually started working with that partner. So I actually met the director for Village Creek. Gosh, I think it was just kind of a random encounter, and I just kind of emailed him and gave him a call and told him what the fellowship was, what the purpose was, and um, he was really on board with it and kind of willing to be a good mentor. So I think it's just a matter of stepping outside your comfort zone and reaching out to folks. I didn't really know him before, so it was kind of a cold call, but it was really great to be able to make that connection that way. I'd also worked as a AmeriCorps member, so I kind of knew a few community partners. So using some of them, even though it wasn't a good fit for other places, they also kind of bridged me to some other folks. So I did call a few people before I set up the Village Creek one to kind of figure out what I was going to do.
That's a great question, Matthew. Why don't we turn it over to Ana? And Ana, when you're describing what you're doing, maybe you can talk a little bit about how you arrived at your site. And yours is a little bit unique too,
Yeah.
right? So
Yeah, so I was gonna say I'm kind of like one of the examples of the new fellows that are leaning more towards less direct service with your underrepresented population, more kind of improving the system so that you can better serve those populations. So I'm a third year at the dental school. My project is to introduce dental Spanish into the curriculum. And so the idea is that the way I see it, I'm kind of aiming to shorten the gap in health literacy with our Spanish speaking patients just by getting students to actually meet them halfway. You know, we have a lot of Hispanic patients, and like the population is definitely increasing. And the hope is that if your assistant or if you as the dentist can communicate effectively, you're going to improve the health outcomes at the end of treatment. So it's a project that I came to. I really just wanted to serve the Hispanic population. I'm from Panama, so I kind of had some empathy for those who have difficulty with the English language, and I kind of like was close to that kind of issue. So it was something I always wanted to do, but what helped me to kind of finalize was definitely a lot of Kristin's help, helping me shape my project, and then speaking with my professors. So something that was asked before, just generally, is how do your classes help you with your project? So at the dental school, we have a class called cultural awareness. And so we spoke about a lot of the disparities in health, just like based off of language and all the aspects that culture can affect in that way. And my teacher was Dr. Mazer, and she is now my faculty advisor, because after taking that class, I kind of like used that information to kind of shape what I thought was lacking in what we have now, and use that to kind of form my project in that way. In terms of how this project has kind of affected my goals later, I'm not obviously graduated, and I haven't finalized any of my decisions yet, but it's definitely really changed how I started off thinking I wanted to do. Just by all the monthly meetings and all the information I'm getting from all of the speakers on health disparities and, you know, what we're lacking, it really kind of, and, you know, my work with my project has really kind of ignited a desire and a drive to meet the needs that we have. And so prior to this project, I was definitely more, you know, kind of just hoping to make some money, and like maybe on the side I would do like mission trips and something like that. Thinking more kind of like that, like more like I'll make my money and then I'll, you know, every once in a while I'll do something. But, you know, this project, you know, you just see so many things and you hear so many things that make you realize that there's more you can do. And so it's really kind of guided my career goals now. I'm, you know, considering entering public health sector, definitely leaning more towards serving rural communities, when before I might have just considered staying in the city. So it really does kind of show you who you are as a person, this project, and really guide you into what you can do to serve your community.
Thank you, Ana. Does anyone have any questions specifically for her? Ana, just so I don't forget, remind me later. I can, if you're interested, connect you to a dentist at the Jefferson County Department of Health if you want to learn from her what her day-to-day life is like. All right, well, I'm sure there will be more questions. Why don't we let Abigayle share a little bit about her project and anything that she would like you to know, and then we'll open up the floor for more questions.
Yeah, hey y'all. So I'm Abigayle. I'm an MS2 at UAB, and my project, I named it the Happy Heart, Happy Mom Project, and I'm working with women who have recently delivered and have heart failure. And what they found was there was either these women were lost to follow-up, and you know the physician that I'm working with didn't really know why, and so my project is a needs assessment for these patients on, you know, figuring out what are the barriers to, you know, getting to appointments. Are there educational gaps, you know, just kind of, you know, overall, you know, what's going on, you know, during the year postpartum that, you know, they're getting lost to follow up. And then I'm also kind of serving as a pseudo patient navigator for these patients. And so I have a phone call with them every 2 months. I administer a survey. And then in between those 2 months, I'm, you know, either just like texting them, or they'll email me and say, you know, hey, this is, you know, a problem that I'm facing. You know, I write it into their survey, and then I also try to connect them with resources at UAB or in their community that could maybe help alleviate the issue that they're faced with. So the reason I got involved with this project was I am interested in OB. So that was a, you know, kind of a big thing. And then also I know like one of the reasons for, you know, UAB that was kind of like on my con list is that in the first and second year, and even third and fourth, you don't really have like a longitudinal relationship with a patient. And this project really allowed me to kind of like create that. And that was just something that I was looking for, because I think, you know, it's important to kind of practice that physician-patient relationship. And then, you know, kind of going off that, I think finding a mentor that kind of is excited about your project and then also plans the project around those goals. And so Dr. Sinke, who's my advisor, you know, one of the things I talked to her about was, you know, I don't have a longitudinal relationship with patients throughout med school. And so she was the one that actually said, you know, why don't we add on this patient navigator piece? So you can kind of, you know, do that during this fellowship. So it's not just the survey. So yeah, I think that's short and sweet.
Any advice you would give, Abigayle, to people who are thinking of applying?
Yeah, I think actually that your MS2 year is a great time to do the ASF project, because again, like 200 hours does go pretty fast. And so I just think it's a great time where it doesn't have, like, if you're trying to do like research grants or anything like that, like they're just the rigor of reporting everything takes so much longer, where in ASF you're kind of learning how to report everything in like a correct manner, and there's just you're just given more grace in that. So that's what I really liked about it too, is that, you know, you're practicing, you know, how to track things, how to, you know, properly you know, implement a research project, but then you don't have the stress of like, oh my goodness, my funding is going to be taken away because I did this incorrectly. And so I really like that aspect of it too. And then I just think find a mentor that's really excited about your project, because I just think that's really important, because you don't want someone to be like dragging their feet on something that you're excited about, and for them it's just like a last minute kind of afterthought.
Yeah, so Abigayle, I think you all have sort of touched on that. Maybe Rachel, when you were saying that your site mentor was really instrumental, and you had, when you reached out to them, could sense that he was going to be supportive. And then Abigayle, I hear you saying both site and academic mentors are both important to kind of have them fully on board.
I'd like to touch on that just real quick, because I had a different idea for my project at the beginning, and just the site that I wanted to work with that would allow me to do that was very not receptive. They really didn't seem like they thought that my project was going to do anything, and they didn't seem receptive to taking the time to help me. And so a big part of my project completely changed because of that. And it was thanks to Kristin, thanks to Dr. Mazer, that I kind of like pivoted towards working with the dental school specifically. And the dental school, just like the faculty that I've worked with have been passionate. They think it's a good project. I think it's very important that you work with a site that thinks that your work is important, because if they think you're just kind of like there as a student to like add something to your resume and you're not really going to help the community, they're really not going to be putting the time to help you or the time to like teach you anything. And so I think it's important that you know that your site also thinks your work is important, and then they'll put the effort to help you out.
And that's probably a good segue for me to explain kind of timeline. And so in Alabama, we tested out something this year. So Ana and Abigayle were a part of a pilot where we allowed them to apply without a project idea fully formed, without a site identified, without faculty or site mentors. I'm sure Rachel's sitting there going, are you crazy? But what we found is that a lot of times the struggle to get that together for an application was so overwhelming that we were losing a lot of great potential applicants. And then on the flip side, we sometimes had applicants who had form a relationship with a community site, and then for various reasons decide not to apply, or perhaps they weren't chosen. So there was disappointment sometimes in our community partners as well. So we thought, well, let's test it out. Like, let's see if it helps both applicants and community organizations if we save some of that work for after selections have been made. And I think, we certainly had a large uptick in applications last year. So I think from a student's perspective, they were appreciative of having some of that burden, put on. It's not that you don't have to do it, right? Because ultimately that work does have to be done. But it at least gave you more time to do it. So we're kind of using that model, but in a modified way this year. So we're going to have our application deadline be February 1. And within the application, you will tell us about some of kind of your interest areas. So you may be able to say, I'm really concerned about access to care. I really want to work with the Hispanic population. Some of these things, like they've been describing, that they sort of knew about themselves and what was going to motivate them. But then in the initial month, March and April, we will work with you real closely. That if you don't, it's totally wonderful if you already have a site identified, but that's not the expectation. So we'll work with you in those first 2 months to get some of those details ironed out. So we're kind of, trying to sort of meet you halfway and make sure that you also know what the needs are, because I think that's the other thing I sometimes hear from our applicants is, they have their ideas, but it may not be based on knowing the Birmingham community well if you're from another, city or state. So that's also what we'll be trying to build in some activities in the beginning of the fellowship year. So let me share, there's a few just sort of next steps. So eligibility, it sounds like everyone joining us today is still going to be enrolled in the academic program through April 2022. So that's great. We do have our orientation date set right there. It's listed as May 1. That's a Saturday. We may do some things online on May 2nd, but not anything too extensive. The application will be online. We're actually in the process of getting it updated right now. So I think by November 1, you should see all of the new questions there. And again, you'll just be telling us more about your interest and goals. And then February 1 being the deadline. Let's see what else. So I would say though, like immediate next step, because we're not doing these sessions face to face, I don't have like a sign-in sheet to pass around and make sure I get your contact information to stay in touch. So I would say that if you haven't already kind of given me your name and email, I'd love to collect it in this form here that you see, ASFA interest. If you share your name and email with me, then I'll be able to email you as we get closer to the deadline. I'll also follow up because in a couple of weeks, we'll have another round of these types of sessions, but some time will be set aside just for almost like office hours for me to be available and help you with the application itself. We're also going to roll out in mid-November a video. I'm doing some, I guess you could call them like little interviews with some community partners. And I want to share what I'm learning from them. They're seeing as the needs on the ground right now. So we'll have a couple of things kind of continuing to happen in November. And I want to make sure you stay aware of them. So just want to open up the floor again for any questions you may have that we didn't answer. Let's see, I think we might have someone asking something in chat. Oh, well, let me give you some other contact information for the fellowship. For those of you who may be on any social media channels, we are even more active this year than in the past, just knowing, again, it's kind of a weird year to be connecting with people. So this is another way just to stay abreast of not just recruitment information, but just to hear stories from fellows and know what's going on. So Instagram, Twitter, and Facebook are all great ways. And I realized that I need to add my email address to these slides, but I will add it to the chat right now for those of you who are joining in person. And I am happy to talk at any point. Let me see. So Kristin.Boggs@schweizerfellowship.org is my email address. So don't hesitate to reach out if at any point I can help you. But we appreciate you joining us today. I'll stay on. I'm gonna stop the recording here, but I'm happy to stay on and talk to anyone as well. So.
And Chris,